Van already discussed with you what a heart issue is, what a plaque is. Many times I get this question, I put this slide up just for the reason because this is a very common question I get asked. What is a heart disease? When somebody walks into my office and say they've got atrial fibrillation, I get question is, on my insurance physical, should I say I have a heart disease? It's a big question. You know, you are applying for life insurance or you're applying for disability or something. Question gets asked is, do I have a heart disease or not? It's a very broad term. Heart disease is a broad term used to describe a range of diseases. Either you can have a coronary disease like heart attack and stroke, or you can have an arrhythmias. So yes, that's considered as a heart disease. Van talked about the coronary disease, whether you got a buildup in a plaque, you got a blocked artery, which leads to chest pain, shortness of breath, heart failure, stroke symptoms. And it also includes the heart arrhythmias. There's different kinds of rhythm issues, whether the electrical impulse causes you to heartbeat too fast, too slow, which causes arrhythmias. There's different kinds, atrial fibrillations, rapid heart rates, PVCs, PACs. There's multiple things that come into the play. The heart of the matter is, there's different people, different race, different gender, but this is the heart disease is one of the most common arrhythmia and common events in the United States. Afro-American female affecting 47.3% of the time. It's the leading cause of the death. You put down all the cancers together. You put down prostate cancer, breast cancer, colon cancer. You put all of these together, heart disease still beats the #1 cause for the death for all of them. But we underestimate them. We see a lot of Susan Komen watch. We see the walk for breast cancer. We see the walk for Alzheimer's. We have a walk for American Heart for the heart walk. But not many people show up because people still underestimate what's the event rate of this sudden heart death is. 82.6 million adults have heart disease. Afro-American females, 47.3% of them are going to have a heart disease in one shape or another. And white females, 33.8%. So there's a definitely disparity, and that's what we need to look into all these things. Hispanic females, 30.9%. That's why every patient that walks into our office, we treat them with each individuality. That's what we need to look at and say, hey, how this patient will get benefit from this treatment versus this treatment. Sometimes we may be very aggressive in treating cholesterol in somebody, or sometimes we may be very aggressive in treating the atrial fibrillation in somebody. We may treat atrial fibrillation in females with anticoagulation much more aggressive than we do that in males sometimes. And the part of that is in atrial fibrillation, females have a higher risk of stroke as compared to the males. Similarly, if Afro-American patient walks into the office, we look at that patient and say, hey, if patient has an atrial fibrillation, this patient is probably going to have more underlying valve issues. And if the white male comes into the office with the atrial fibrillation, I look at that and I say, this patient is most likely going to have underlying coronary disease as well as compared to the other patients. So every patient gets individual treatment because this is what the data shows it to us. Experts estimate 1 in 2 women will die of heart disease or stroke compared with 1 in 25 women who will die of a breast cancer. So even though, so that way we have so much awakening about the breast cancer, but we don't talk much about the heart disease in this aspect. That's why we wanted to bring this program to the public so they can understand where we stand. Heart disease being, like Van said, heart disease being overweight, obese, having high blood pressure, prevalence among women as they age. Some people have accepted this as a way of life. But like Van said, heart disease and the most risk factor can be prevented. Take responsibility for your health.